Hi, Paul Sackett, Good News Broadcast, speaking to Karen Redlener. Hi, Karen, how are you?
I'm great, thanks. How are you?
Okay, Executive Director of the CHF, but also that's the Children's Health Fund, right? That's your organization?
That's it.
Nonprofit organization committed to providing health care to the nation's most medically underserved, that's a big word, children and their families. And you're working with the Clorox Corporation company that does many good things, and you're partnering to launch the Children's Kids to Care. Okay, what's Children Connect Kids to Care event going on?
Right. So basically, the Children's Health Fund is an organization that I founded with my husband and Paul Simon 23 years ago.
I thought so.
And my husband's a pediatrician.
He sure is.
And we've been involved in healthcare for what we call medically underserved children for most of our careers.
In the Bronx.
And yep, we have programs in the Bronx. We have programs in Harlem, and then we have a national network of programs around the country outside of New York City as well.
You
24
do
different
good.
Programs.
I love you guys. I've been there before. I've been where you've had Paul Simon, Chevy Chase. In fact, when I went up to Chevy, I messed it all up because the machine didn't record. I was so sad. But I saw him later at some other cancer event that he did. And these people really come out, and you guys have been doing a great job for so many years. I know you've worked with a lot of good corporations. So here's another one, Clorox coming to the table, right?
Exactly. So what we're excited about with Clorox is to partner around this initiative, this campaign called Connect Kids to Care. And Clorox is going to be donating $500,000 to the Children's Health Fund to help us provide 500,000 healthcare encounters to children and families over the next 2 years.
Mm-hmm.
And then in addition to that, they will donate an additional $1 for every individual who becomes a fan of Clorox on Facebook. So that's a way that, consumers and others can kind of participate and help support the cause as well.
Okay. I just, when I read through your materials, it reminded me of a couple events I've been with, and your husband's already on Good News and your organization. How did you guys get started?
Well, actually, Irwin and I met in the early 70s working in a community health center in rural Arkansas.
Mm-hmm. Wow.
So we've both been committed to, developing services and really helping low-income communities get good quality health care for most of our careers. And so over the years, we worked in different communities and different campaigns. And then in the mid-'80s, we were in New York City, and Irwin had an opportunity to meet Paul Simon through the We Are the World organization. And Paul was interested in the homeless situation here in New York City. And Irwin, as a pediatrician and involved in We Are the World, was very concerned about health care for kids that didn't have access to it. So they took a tour of welfare hotels in New York City to see the conditions, the terrible conditions that homeless children and families were living in at that time, and realized that we could develop a program that would bring health care to kids right on site in the shelters that would really assure that the kids could have access to good quality care. So I got involved at that point because I'm kind of the administrator, program developer, detail person, and I helped to, design a mobile medical clinic that is fully contained in a 35-foot-long kind of custom-designed recreational vehicle, and it's like a doctor's office on wheels. And we developed a program to bring this medical team to welfare hotels and homeless shelters in New York City, so that kids could get good quality health care. And so, our model is mobile, and that's a kind of a unique feature of our programs, is that we target, as we said, the most medically underserved. So these typically are kids that are in, kind of rural communities with no doctors, in poor communities with no resources, with a lot of risk factors of poverty and low literacy and that type of thing. So our mobile units go to reach those communities and make healthcare accessible with a great healthcare team, doctor, nurses, psychologists that provide the care in an ongoing kind of way.
Now, you have a very sophisticated hospital as well for children, right?
Program. Our programs in our national network are all affiliated. Each one of them is affiliated with either an academic medical center or a community health center. So they're part of a larger system of care. So, when the kids come on to the mobile clinics to get primary care, they become part of a larger health system. So if they need, let's say, access to a subspecialist, a cardiologist, or some type of specialty care, they are able to access that through the larger system of care that our programs are related to.
So it's all working together. Everybody's forward motion here.
Exactly. And we've developed a very comprehensive model of care over the years because we feel that that's what medically underserved kids really need. A pediatrician, a social worker, psychologist, nutritionist, to get the full range of care that they need. And, we've developed the model, which is very high quality, and we wanted to, provide services that we, we would want our own children to be able to have. So, we've focused on that as well.
Uh-huh. Well, you by far are both very do-gooders. I know you're even principal for the days. I've seen you guys around a lot of places because you're out there in the community, and your units are very sophisticated, right? I mean, in general.
They are. We've been able to design a kind of as I said, a doctor's office on wheels that has everything that you would need to provide good primary care. In addition, to exam rooms and scales and asthma treatment equipment, we've always used electronic health records, which is quite unique. We actually custom designed electronic health records in the late 80s so that we would have comprehensive medical records available for these very transient, populations that we were serving. And so we've had over 20 years of experience using electronic health records to help us.
Is that the electronic health records concept in that 17 billion page health insurance
yes, it is.
program?
Yes, it is.
Is it?
Yes, it is.
I hope it takes...
There's a big push to roll out electronic health records in all healthcare systems in our country to really, facilitate better quality of care, access to information, good reporting, less duplication. There's a lot of good things that can happen from that.
Yeah, it's that was quite antiquated, and the possibility of going. Most people don't even know their blood type, right? And
right.
To be able to log in.
Eventually, yes, to have the patient access their own medical record is one of the, kind of the goals of making care and making information more available, to the doctors as well as the patients.
Sure, it's a beautiful thing. To get Clorox involved, now Clorox has been out there for many years. How did that all come about for you?
Well, actually, they approached us. They were looking for a way to kind of highlight their commitment to the community, and we're looking for a nonprofit organization that really cared about and was involved in good healthcare, preventive health, and keeping kids healthy. And it was a good match for them, and we got to know each other, and we said this will be great, and the kids will benefit, and we'll it'd be appropriately bringing Clorox some attention for the work that they're doing to help kids get health care. And so we developed this campaign. It's going to be a 2-year relationship, and we're very excited about it.
Great. Well, and the people should be going to facebook.com /Clorox, right?
Right.
And then there will be some additional donation to you, right?
They can if they would like. It's not part of the campaign. If they just fan Clorox, then Clorox will donate $1 to us. And if they're motivated to help us in addition to that, that would be great.
Now, you have 50 mobile medical clinics. Do you think with this kind of opportunity in association with Clorox, maybe there'll be some more that you'll be able to put out into the...
Well, at this point, their contribution is helping us pay for the doctors and nurses. So,
Okay.
every year we need to raise a lot of money to keep the programs running and keep those units on the road. So,
Sure.
their focus is to keep those healthcare visits coming, and we're always planning, kind of looking forward and identifying resources that will help us build more of those clinics and go into more communities across the country. But at this point, we're working with Clorox to keep them on the road.
I'm sure you saved a few lives in those mobile units.
I know that we have. You are right. Some things we just can't imagine how in some communities children have not seen a doctor for many years.
Mm-hmm.
And, there are children who are sick and children who have diagnoses that haven't been recognized before. And our doctors are very, very committed and what we call mission-driven. They want to be in poor communities and helping families that need this care desperately. So they're very committed and go the extra mile to make sure kids get the care that they need. So,
And sometimes a hospital's a little bit scary to take a child to a hospital, for a child to go to a hospital, and this is you're in the turf, right?
Yeah.
You're the real thing. You're right in the community. You're on the street, right? You're in the streets.
Yeah, we go out to homeless
Right.
shelters, community sites, schools. Sites, over 200 sites are
Mhm.
served every week, and we have a regular schedule, so we go back to the same sites every week, so we can provide continuity of care.
Okay, so then then it becomes internal talk that you're going to be back, maybe.
Exactly.
This is the time you should go see a doctor. Some people, it's tough to budge them, right?
It is, and you want to make it the care very accessible because people, all of us are incredibly busy, and people who are struggling to make ends meet and just put food on the table, they have so many other issues that they're dealing with. So we want to make healthcare easy to access for the families, so that the kids can get the preventive services as well as the the treatment of their illnesses as regularly as possible.
Well, thank you so much for doing all this. Last question, what's good news for you, Karen?
Good news for me is the passage of healthcare reform.
Okay.
Bringing more health insurance to kids across the country and, helping us reach our goals.
Okay, fantastic. Well, it's a pleasure and honor to get to speak with you. Some in regards to your husband and the whole group over there. Thanks,
Thank you so
Karen.
much for your work. Okay.
Thanks. Bye-bye.
Thank you.
Bye-bye.
Bye-bye.